Ranking Member Byrne, thank you to all of our witnesses for being here today and for your ongoing work. I deeply appreciate it. Dr. Fauci, I want to start with a couple of questions for you. We need to make sure that individuals who become seriously ill with COVID-19 can receive treatment and that doctors have clear guidelines on the effectiveness of each treatment for the latest variant. And you touched on this in your opening statement, but I would like you to just expand a little bit on this. In light of Omicron, how is the administration evaluating new COVID-19 treatments and monitoring the effectiveness of existing treatments?
Thank you for that question, Senator. There are a number of studies that have been conducted and that are being conducted right now, and they have to do with studies that are NIH-sponsored, one of which is the Adaptive COVID-19 Treatment Trials, or ACT, A-C-T-T, which in fact have been from the very beginning, as early as February of 2020, was the basis for the FDA approval of the antiviral remdesivir. Other of those studies, particularly those on monoclonal antibodies, showed several of them in the clinical trials to be effective at first against Delta. We know now that a couple of them, except for one, has now lost some of its effectiveness. There's another group of studies called ACTIVE, and there are 6 of those, and that stands for Accelerating COVID-19 Therapeutic Interventions and Vaccines, and the whole gamut of oral, IV, monoclonal antibodies, direct antivirals. And as I mentioned in my opening statement, antivirals like Paxlovid and Molnupiravir, the original research had been done in the early trials by the NIH. But importantly, in direct answer to how we know what to use, the NIH has put together a guidelines panel made up of 48 highly qualified clinicians and individuals with experience in COVID-19 to give a prioritization of what you do if you're infected and with advanced disease in the hospital, as well as what you do as an outpatient. And they're fairly clearly delineated in the guidelines, which is easily accessible by just going to the NIH website and going to nih.gov and then guidelines panel. And people can get a good idea, clinicians throughout the country and the world, of how to use these antivirals. Thank you.
Thank you. I want to follow up. I am grateful that the administration heeded my call to send FEMA teams to New Hampshire to help administer COVID-19 treatments. However, the teams were delayed in arriving and are scheduled to stay only for a short period of time. So, Dr. Fauci, what additional personnel and support is the administration planning to provide to New Hampshire and other states to help treat COVID-19 patients in the most effective way possible?
Well, there are several things. Perhaps Assistant Secretary O'Connell can answer, but I can start off by saying that there are surge teams right now, at least 60 surge teams, that have been deployed to help those areas that have difficulty because of the surge and the fewer volume of cases to be able to handle them with regard to everything from hospitalizations to treatment and other implementations.
And I appreciate that Assistant Secretary O'Connell is in a good position to follow up, and I would like to follow up after the hearing. But I did want to ask one other question to Dr. Walensky. We've long had problems with accurate state vaccination data in New Hampshire. It's come to light that the CDC's data on New Hampshire's vaccination rates is also inaccurate. Apparently, the CDC can't consistently distinguish in its data between first doses of the vaccine and boosters. And as a result, the agency incorrectly records boosters as first doses, artificially raising the vaccination rate. The CDC's data is inaccurate for other states as well. We've been looking at this for other states too. So what steps is the CDC taking to resolve these data inaccuracies? And when will the CDC have accurate data for New Hampshire?
Thank you, Senator. This is a really important question. So CDC is the compiler of the data, and we rely on the state immunization services to provide CDC the data at the state level. Now, among the challenges with these accuracies is that if people don't bring in their card, they are counted as a first dose when in fact their card would have been a third dose, and we rely on the states to work to reconcile any differences if a person put in a middle initial on one card but not on another. And we're working closely with every single state to increase the accuracy. We're encouraging people to bring their cards because that also increases the accuracy. We recognize this challenge, and we are working state by state, including in New Hampshire, to reconcile these inaccuracies to get them more accurate in our comprehensive reporting of every state.
Well, I appreciate that very much. Thank you, Madam Chair. I'll just say that what I'm hearing you say to the general public is it's really important to help with the accuracy of data by keeping your card, taking a photo of your card, making sure that you're sharing all your information at the site where you're getting a vaccine or booster shot.
Very helpful, yes. Thank you very much.
Thank you.
Thank you. Senator